Good afternoon, everyone. Welcome to the Health Breakdown. It's a pleasure to be here with you today. We all want to stay active, mobile, and strong as we age, and let's be honest, keeping our legs working well is key to independence, whether it's walking, dancing, or simply getting up from a chair without help. As we age, our bodies process nutrients differently, and our nutritional needs change. While vitamins are essential to overall health, it's a common misconception that more is better. In reality, excessive intake of certain vitamins after the age of 60 can lead to unexpected side effects, including leg weakness. This issue is especially concerning for seniors, as weakened leg muscles can contribute to falls, decreased mobility, and a lower quality of life. Understanding how too much of a good thing can become harmful is essential for making informed choices about supplementation in later years. One of the reasons vitamin overload can occur in older adults is the increasing popularity of supplements. Many seniors take multivitamins daily and may also add in individual vitamin pills, often without consulting a healthcare provider. Unfortunately, this can easily lead to consuming more than the recommended upper limit of certain nutrients. Unlike water, soluble vitamins, which are generally excreted in urine if taken in excess, fat-soluble vitamins like A, D, E, and K accumulate in the body's tissues. When stored in high amounts, these vitamins can interfere with normal body functions, particularly muscle and nerve function related to leg strength. For example, high doses of vitamin E have been linked to muscle fatigue and weakness. While vitamin E is known for its antioxidant properties, overuse can interfere with muscle metabolism and impair coordination. This may not be immediately obvious but can gradually result in difficulty walking, standing up, or maintaining balance, all of which are essential functions of strong leg muscles. Similarly, taking too much vitamin A, especially in its preformed form retinol, can affect bone health and contribute to joint pain and muscle discomfort. Since vitamin A is often found in multivitamins and fortified foods, seniors who take multiple supplements may not realize how much they're getting. Over time, this can lead to muscular stiffness or a sense of heaviness in the legs, limiting everyday mobility. Another concern is excessive vitamin B6. While B6 supports nerve function in moderate doses, prolonged use at high levels can cause nerve damage, known as peripheral neuropathy. This can manifest as numbness, tingling, or weakness in the legs and feet, making it harder for older adults to walk safely or remain physically active. In some cases, excess vitamin D, especially without balancing calcium and magnesium intake, can result in muscle cramps or weakness. Seniors often take high doses of vitamin D to support bone health, but without proper medical guidance, this can backfire, especially if they're not deficient in the first place. The key takeaway is that while vitamins are crucial to maintaining health, oversupplementation can cause harm, particularly in the form of leg weakness and reduced mobility. It's important for seniors to work with healthcare providers to tailor vitamin intake to their actual needs, ideally based on blood tests and dietary evaluations. Staying informed and cautious about supplement use can go a long way in preserving strength, balance, and independence in later life. Vitamins E, A, and D are often promoted for their health benefits, especially as people age. They play vital roles in supporting the immune system, maintaining healthy vision, promoting bone strength, and protecting cells from damage. However, when consumed in excess, particularly through supplements, these same vitamins can actually contribute to muscle or bone problems, especially in individuals over the age of 60. Seniors need to be especially cautious, as their bodies process and store nutrients differently than younger individuals, increasing the risk of toxicity or imbalances. Vitamin E is well known as a powerful antioxidant, helping to protect cells from oxidative stress. In moderate amounts, it can support immune health and circulation. However, when taken in large doses, typically over 400 IU per day, It has been associated with muscle weakness and fatigue. This is because excessive vitamin E can interfere with muscle function and potentially affect the body's natural ability to contract and control muscles. This effect can be subtle at first, presenting as general tiredness or a lack of stamina, but over time it may progress to noticeable muscle weakness, particularly in the legs. For seniors, this is especially problematic, as weakened leg muscles increase the risk of falls and limit mobility. Vitamin A, another fat-soluble vitamin, is critical for vision, skin health, and immune function. However, in its preformed form, retinol, which is commonly found in supplements and fortified foods, it can accumulate in the body and become toxic when taken in high amounts. Chronic overconsumption of vitamin A can lead to a condition called hypervitaminosis A, which is known to cause symptoms such as joint pain, muscle aches, and bone thinning. These issues can lead to discomfort and reduced mobility, especially in the legs and hips. Seniors who take multivitamins that include high doses of vitamin A, in combination with a diet rich in fortified foods, may unknowingly consume more than their bodies can safely handle. Unlike beta-carotene, which is a plant-based form of vitamin the body converts as needed, retinol builds up and can contribute to both muscle discomfort and weakened bones over time. Vitamin D is essential for bone health, as it helps the body absorb calcium. It is often prescribed to seniors to prevent osteoporosis and maintain bone strength. However, taking too much vitamin D, especially without monitoring calcium and magnesium levels, can have the opposite effect. Excessive vitamin D can lead to muscle cramps, weakness, and calcium buildup in soft tissues, which may contribute to stiffness and pain. Some seniors mistakenly believe that taking large doses will offer more protection, but too much can disturb the delicate balance of nutrients needed for proper muscle and bone function. This imbalance can result in sore, heavy legs, or even long-term bone pain. In summary, while vitamins E, A, and D are all important to health, their overuse through supplementation can cause or worsen muscle and bone issues in older adults. Proper dosing and medical guidance are essential to ensure these nutrients support rather than harm physical strength and mobility. Vitamin B6, also known as pyridoxine, is a water-soluble vitamin that plays a crucial role in brain development and keeping the nervous and immune systems healthy. It helps the body convert food into energy and supports neurotransmitter function, which is essential for proper nerve communication. While vitamin B6 is vital for overall well-being, especially in seniors who may be prone to nutrient deficiencies, excessive intake of this vitamin, and particularly through supplements, can lead to serious consequences. One of the most concerning side effects of too much vitamin B6 is nerve damage, which can significantly impact mobility, balance, and leg strength. Unlike many other water-soluble vitamins that the body typically excretes when taken in excess, vitamin B6 behaves differently at high levels. When consumed in large doses over a long period of time, it can build up in body tissues and cause neurotoxicity, leading to a condition known as peripheral neuropathy. This condition affects the peripheral nerves, the nerves outside the brain and spinal cord, which are responsible for transmitting signals to and from the limbs. Early symptoms often include tingling, burning, or numbness in the feet and legs. As it progresses, it may result in muscle weakness, especially in the lower limbs, making it difficult for seniors to walk steadily or maintain balance. The risk of vitamin B6 toxicity increases when seniors self-prescribe high-dose supplements or take multiple products containing B6 without realizing the total amount they are ingesting. Energy drinks, fortified foods, B-complex vitamins, and multivitamins often contain B6, and the combined intake can quickly exceed safe levels. While the recommended daily allowance RDA for vitamin B6 in adults over 50 is around 1.5 to 1.7 mg, studies have shown that symptoms of nerve damage can occur at doses as low as 50 to 100 mg per day when taken over an extended period. Some over-the-counter supplements contain 200 mg or more in a single dose, far surpassing what the body needs. Seniors are especially vulnerable to this kind of nerve damage because age-related changes can make the nervous system more sensitive. Once peripheral neuropathy develops, it can take months or even years to reverse, and in some cases the damage may be permanent. The symptoms, such as unstable gait, numb feet, and muscle weakness, can severely impact independence and increase the risk of falls and injuries. To avoid these risks, it's important for older adults to review their supplement intake with a healthcare provider. Blood tests are rarely needed unless toxicity is suspected, but it's essential to read labels carefully and avoid exceeding the upper intake limit, which is set at 100 mg per day for adults. Most people can meet their vitamin and B6 needs through a balanced diet that includes poultry, fish, bananas, and fortified cereals. In conclusion, while vitamin B6 is necessary for nerve health, too much can do more harm than good. Seniors should be especially cautious with supplementation to avoid the very nerve damage they may be trying to prevent. Iron is a vital mineral that helps transport oxygen in the blood and supports energy production in cells. It is essential for preventing anemia, a condition characterized by fatigue, weakness, and pale skin due to a lack of healthy red blood cells. While iron is crucial for maintaining health, particularly in younger individuals and menstruating women, seniors, especially men and postmenopausal women, and typically need less iron. In fact, iron supplements can be harmful for older adults who do not have a diagnosed deficiency, and taking them unnecessarily can lead to several serious health issues, including leg discomfort and weakness. One of the main concerns with unneeded iron supplementation is the risk of iron overload, a condition known medically as hemochromatosis. This occurs when excess iron builds up in the body's organs and tissues, leading to inflammation and damage. While hemochromatosis is often genetic, iron overload can also occur in seniors who take high-dose supplements over time without medical supervision. The liver, heart, and pancreas are particularly vulnerable, but iron can also deposit in joints and muscles, causing fatigue, joint stiffness, and leg pain, symptoms that may be mistaken for normal aging or arthritis. Another reason iron can be problematic in older adults is that as the body ages, its ability to regulate and eliminate excess iron becomes less efficient. Unlike some other nutrients, iron is not easily excreted from the body. Once it accumulates, it begins to create oxidative stress, damaging cells and tissues. This stress can affect the muscles and nerves in the legs, leading to a feeling of heaviness, weakness, or soreness, which may impair walking and balance. In the long term, these effects can reduce mobility and increase the risk of falls, a serious concern for aging adults. Excess iron has also been linked to other health risks, including an increased likelihood of developing conditions such as type 2 diabetes, heart disease, and neurodegenerative disorders like Alzheimer's disease. These links are still being studied, but the evidence suggests that iron should not be taken lightly, especially by those who are not deficient. Despite these risks, many seniors continue to take iron supplements just in case, often because they feel tired or low in energy. However, fatigue in older adults is not always caused by iron deficiency anemia, and supplementing without testing can do more harm than good. It's important to remember that anemia can result from many different causes, including vitamin B12 deficiency, chronic disease, or kidney issues, all of which require different treatments. The best way for seniors to determine if they need iron is through a simple blood test. If iron levels are normal, supplementation is not necessary and should be avoided. Instead, older adults can focus on maintaining a balanced diet that includes small amounts of iron, rich foods like lean meats, beans, and leafy greens, without overloading their system. In short, while iron is essential, more is not always better, and taking iron supplements without a clear medical need can lead to long-term complications. Seniors should approach iron supplementation with caution and always consult a healthcare provider before starting. As people age, their nutritional needs change, and the body becomes more sensitive to imbalances in vitamins and minerals. While supplements are widely available and often marketed as essential for healthy aging, they are not always the best or safest option, especially when taken without medical supervision. For seniors, relying on whole foods, regular blood tests, and professional medical advice is a far more effective and sustainable way to maintain strength, especially when it comes to preserving leg function, mobility, and overall vitality. Whole foods offer nutrients in their most natural form, complete with the vitamins, minerals, fiber, and enzymes that help the body absorb and use those nutrients effectively. Unlike isolated nutrients in supplements, the vitamins and minerals in food work synergistically. For example, consuming iron from leafy greens or red meat provides not only the mineral itself, but also supporting compounds that enhance absorption and reduce side effects. Similarly, getting calcium from dairy or leafy vegetables includes other beneficial nutrients like magnesium and vitamin K, which work together to strengthen bones and muscles. Whole foods also reduce the risk of taking too much of any one nutrient, which can happen easily with supplements and lead to issues like nerve damage or muscle weakness. Regular blood tests are equally important. Many symptoms like fatigue, weakness, and tingling in the legs can be caused by nutrient imbalances, but they can also be signs of other medical conditions. Without proper testing, it's impossible to know whether symptoms are due to a deficiency or an excess. For instance, leg weakness might be a result of low vitamin D, high vitamin B6, or even iron overload. Each of these requires a different approach to treatment. Through routine blood work, seniors can identify actual deficiencies and tailor their nutrition and supplement plans to match their specific needs, avoiding guesswork and reducing the risk of unintended harm. Medical advice plays a crucial role in this process. A healthcare provider can interpret test results, assess dietary habits, and consider other medications or conditions that may affect nutrient absorption. Seniors often take multiple prescriptions, and some medications can interfere with how the body uses certain vitamins. Only a trained professional can evaluate these interactions and recommend the right dosage, or determine that supplementation isn't needed at all. Self-prescribing supplements based on general advice or internet research may overlook critical personal health factors and lead to overuse, toxicity, or misdiagnoses. In addition, doctors and registered dietitians can help seniors make informed choices about food and lifestyle habits that support long-term health. Instead of focusing on supplements to fill perceived gaps, they can guide seniors toward balanced meals that naturally provide essential nutrients. This approach not only nourishes the body more effectively, but also supports digestion, immune function, and cardiovascular health, all of which contribute to better mobility and leg strength. In conclusion, while supplements have their place when medically necessary, the foundation of senior health should rest on whole food nutrition, regular monitoring through blood tests, and personalized guidance from healthcare professionals. This balanced, cautious approach helps maintain strength, prevents complications, and supports a healthier, more independent life.